Hello everyone. Can you all hear me? Am I audible? Am I visible? We'll start with the anesthesia recall that came in your NEET PG 2023. Hi everyone. Hi, good evening, good evening. I'm very happy to see the enthusiasm that you guys are showing. It's pretty late and I know you guys are tired, so I'm going to keep it very short. Yes, that is a very happy feeling, Ankit. I know. So we'll go straight away. I got to collect around 4 questions that came in your anesthesia part, and the questions were pretty straightforward. Nothing much, no surprises. First question: when to put your patient in the given position, and they gave this position, and this is a very typical position. Which we call as a recovery position, and we have all done this position, given this position to pediatric patients or patients who we receive in the casualty. And the hallmark of this position is that this position is done in a alive individual. That is the most important part. Somebody who is alive, somebody who is breathing, somebody who has pulse. In that position, in that patient, we give this position. Options were pretty straightforward. Unconscious patient was a very constant thing, that the patient is unconscious. Only thing that we had to deal with was pulse and breathing. And we know that if pulse and breathing are absent, then we go for CPR, and CPR is done in supine position. If pulse present, breathing absent, again this is a CPR position and you do it in supine. And pulse absent and breathing present, this is a condition that can never exist. Okay, we know that this is a position that can never exist. Somebody cannot be pulseless and with breathing. So the correct answer to this question is pulse present, breathing present. It is basically when you get an unconscious person who has not suffered cardiac arrest. It is not cardiac arrest. So any person with not cardiac arrest, you would obviously put them in recovery position. Recovery position is very easy to give in an unconscious patient. You keep one hand below the head, another hand either like this or straight like this, then one leg straight, another bent over this. This will help the secretion to come out. It keeps the breathing intact. The patient doesn't aspirate, and they also do not get any pressure on their surface. How am I speaking without my lips moving? Is my camera not working? Okay. Yeah, okay. Sorry, my camera is not working. Just give me a minute. Just give me a minute. All right. Now you'll see me with my lips moving. All right. Yeah, right. So this was recovery position. Okay. I'm sorry, answer B, recovery position. Second is again an image-based question, and this is something which came straightforward from the DBT that we discussed. Identify the position. Options were head tilt, chin lift, jaw thrust, manual inline stabilization. I could not get the fourth option, but the answer was pretty clear. The image was like this. It is a head tilt, chin lift maneuver. When somebody put a jaw thrust, then it would look something like this. And manual inline stabilization is when you keep both of your hands at the cervical spine to stabilize the cervical joint, right? So it was a pretty straightforward question. The image I think that was given was this: head tilt, chin lift. And this is one of the basic airway maneuvers that we perform in any unconscious breathing absent patient, that is a cardiac arrest patient. You can even perform it in an unconscious patient with head injury. It's basically basic airway maneuver to open up the airway. We discuss this a lot, right? Which of the following is not an indication to use this device? And surprisingly, they gave a tracheostomy tube. Now we know that tracheostomy tube is a permanent airway management technique. And we discuss in detail about temporary airway management, which is the endotracheal tube. And they could have made this question little difficult, but then one option that they give actually pretty much made it very simple for us. They gave assessment of airway. Now a tube, whether it is endotracheal tube or a tracheostomy tube or supraglottic airway device, any tube in the world, tube will never be used for assessment of airway. Can it be used for management of airway? Yes. Can it be used for pulmonary toilet? Yes, definitely yes. And prolonged mechanical ventilation is one of the prime reasons why you insert a tracheostomy tube in an ICU patient, that is prolonged mechanical ventilation. Okay, yeah, cakewalk question, no brainer. Antibiotic of choice for a patient posted for elective cardiac surgery. So we know that in pre-medication, we read that we have certain goals for pre-medication. One of the goal is prevention of infection, and in that we read that we have to give antibiotics, and for routine surgeries we have three choice of antibiotics: cefazolin, vancomycin, and gentamicin. And we prefer this as first line, and we always give it within 60 minutes of incision, right? So this is an information that we already know. Yes. So it's a straightforward question again. Cefazolin. Options can vary. Penicillin is a constant option. Then I heard azithromycin, I heard clarithromycin, somebody said erythromycin. Then in the discussion of pharmacology, somebody said no sir, erythromycin was in another question, something like that. But whatever, if cefazolin is given in the option, then cefazolin would be given. Again, Cipro, ceftriaxone, doesn't matter. If cefazolin is given in the option, then yes, you will always mark cefazolin, right? So these were the 4 questions that I could recall. I could get from you all only. If there are any more questions, then you can tell me if there's something plus minus. If you want to ask something, you want to tell something, how was your experience? Yes, it does felt little lengthy. So, but then feeling of lengthy and shock also depends on your level of preparation. Sometimes when you are not prepared at all, then the patient seems very easy. There's very short paper because you basically don't know anything. But when you know remember a lot of stuff, then automatically the paper becomes very difficult and tough, because then you read it properly and you have to think a lot because you know a lot of stuff. Yeah, Ankit. No, so Aditya, predominantly we use cefazolin. That is what the guidelines say. That if somebody has to be given preoperative prophylaxis, then yes, 3rd and 4th generation cephalosporin is what we are talking about. But then the drug that gets its name is cefazolin. Right. Any other question? Anything else that you want to talk about? Thank you, Dr. Watson. See, this is the days like these, it makes our year, because whatever we try to give you all throughout the year, it feels good when at the end of it, it helps you and you guys are happy. Thank you so much. Thank you so much. Yeah. See, don't think about results, don't think about marks, don't think about anything. Just recall and maybe take a day off tomorrow and start with your INICET preparation. See, till the results have come out, you don't really have a seat. So I would suggest that not to waste more than a day. And you need one day to relax. Today you're spending a lot of time in the recall. So tomorrow take a break, go for a movie, have a nice lunch, come back, sleep early. Day after tomorrow, start with your INICET preparation. Okay. If you have not submitted, I guess if you have not submitted the answer, reviews are not considered to be wrong answers. That is what I remember from my time. And of course, we have not been on the system there, so I'm not pretty sure. Yes, Adit, that does happen, and that is the trick with MCQs, that there are two options where you really get. INICET, they have announced the date, it's on 7th of May. Shashikala. Thank you, Manisha. Thank you so much. You're saying percutaneous tracheostomy for what? See, it doesn't matter whether it is percutaneous tract or a tract. Doesn't matter. Tract is tract. Percutaneous tract doesn't really make a big incision, so you do it via percutaneous technique. So the technique of insertion is percutaneous, but tract is tract. Yeah, right, Karan. So I'll add this thing. It was upper airway management. No, the assessment of airway is what you are saying, right? Okay, nobody has told me this thing. Dr. JR, what are you saying? One picture with a hole in the throat with option of percutaneous tract. Yeah, upper airway assessment. Yes, very good. Okay, so I'll add this upper airway. Yeah, that could have been. Okay, so that would have been a ENT question where looking at the throat, you could tell whether it is a percutaneous tract or a total laryngectomy. Yeah, okay, fine. वो ENT का question, yes. Yes, that would have been an ENT question. Yes, that was an ENT question. So I would not take much of your time. See, I'm available everywhere for you. You can send me a message on Instagram. My Instagram page now names Anesthesia Shorts by Anshul. You can messenger me on Facebook. You know how to tag me on the club. If you have any doubts, you want to discuss something, you want to discuss future strategies, I'm always available for you all. I wish you all the very best. I'll hand over the baton to the next teacher, so guys, you guys can go ahead and we'll have a lot of time to talk. So I just hope that so any airway management technique, Dr. Khurram, you can do pulmonary toilet. See, pulmonary toilet is simply something that you do in, say, alveolar proteinosis, where you push some fluid, you cause mixing of that, and then you take it out. So that is called as pulmonary toilet. So somebody has a infection or somebody has a so you can do a bronchoscopically guided pulmonary toilet, or you can do a manual pulmonary toilet. So any airway management technique you can do pulmonary toilet. Yeah. All right. Thank you, Muskan. Thank you, Ankit. Thank you, competent alien. Yes, Dr. Watson, Dr. Khurram. Thank you so much, and good night. And I'm always available for you all to discuss any questions that you want. All right. So good night. Bye bye, and see you.